What are my options for treating acute lymphocytic leukemia?
I call ALL, again, a lightning strike diagnosis. And what that means is it happens out of nowhere and then it feels like you lose complete control. Now, there is pretty standard therapies for ALL up front, especially at the very beginning when we're trying to kill off all those cells and get people into remission. Um, I do think that it's always important to ask if your center is participating in any clinical trials. For children, almost all of those patients will go on a clinical trial or will be treated per a clinical trial. That's the same for our young adult patients as well. As we get older, we have less trials and we have more standard therapies, but it's always a good thing to ask about what are the options of therapies. Now, in general, in ALL, there will be probably a best option based on your disease, especially as I said up front. We do this thing called induction. So I think of treating leukemia as a two-step process. The first step is you have leukemia. We need to get rid of it. We need to take you to what we call remission. Now, remission means your cancer is gone and we can't find any part of it, but at the same time, your blood counts are normal. That's remission. Anything other than that is not remission. We need no cancer and your blood counts normal. That is step one. Now, you might say, well, why is there a step two if we've gotten rid of the cancer? And the answer is, again, we have to get rid of every single cell. And so we have to get past step one, then we can go to step two, which is consolidation, and that is removing every last cell in the body, even the ones we can't find with conventional tests. So when I talk about that step one, the induction piece, that is pretty standard a lot of the time. And then as we go forward and we start talking about consolidation and talking about where you are in your disease process, we talk about, is there any cells we find? What do we need to do? How do we get rid of them forever?